Understanding the cannabinoid system is a primary component of making the best choices for you when using cannabis to treat medical conditions. Here in Washington State, the law only requires testing for Delta-9 THC and CBD, a good start when making decisions for you, but only a small part of a much larger puzzle. Luckily for us, the cannabis industry here understands, particularly if they have a medical focus, and does test for a wider range of cannabinoids. So far in this series, we have explored what cannabinoids are and how they evolve over time. If you've missed those videos, we will provide a link in the description of this video, or check out our cannabinoid playlist on YouTube. There are three primary life stages of all phytocannabinoids. These are raw, heated, and aged. Raw cannabinoids are the naturally occurring, non-decarboxylated forms of cannabinoids found in the cannabis plant. They are not psychoactive in their raw state, meaning they don't produce the high associated with THC. Instead, they are often consumed for their potential therapeutic benefits, such as anti-inflammatory and neuroprotective properties. As the female cannabis plant begins to mature and starts to flower, the first phytocannabinoids begin to form. These are cannabigerolic acid and cannabigerol. This process is called synthesis. CBG is a non-intoxicating cannabinoid and is often referred to as the mother of all cannabinoids. While research is ongoing, CBG shows promise in various areas. CBG is being investigated for its potential anti-inflammatory and pain-relieving properties. Various studies have suggested the use of cannabinoids as possible treatments for inflammatory diseases, such as liver injury, rheumatoid arthritis, allergic asthma, and inflammatory bowel disease, IBD, which is a group of chronic inflammatory conditions of the gastrointestinal tract. The two primary types of IBD are Crohn's disease and ulcerative colitis. Additionally, by reducing pain signaling in the nervous system, CBG might offer relief from chronic pain conditions. Neuroprotection is a therapeutic strategy aimed at safeguarding the nervous system. It encompasses a diverse range of approaches, all striving to achieve a common goal: shielding neurons from damage and promoting their survival. CBG, like other cannabinoids, has shown potential neuroprotective properties, primarily through its interaction with the endocannabinoid system. CBG may help reduce neuroinflammation, which is associated with various neurodegenerative conditions, such as Alzheimer's disease, Parkinson's disease, and multiple sclerosis and Huntington's disease. Overall, current studies suggest that CBG has promise as a neuroprotective agent. CBG may help improve digestion and relieve symptoms of conditions like irritable bowel syndrome, IBS, according to CannMD. Research suggests CBG may help reduce intraocular pressure, a factor in glaucoma. Glaucoma is a primary cause of irreversible vision loss, and intraocular pressure remains the only modifiable risk factor for disease progression. Accumulating research indicates CBG may have antiproliferative effects, potentially making it useful in cancer therapy. Evidence has substantiated the anti-tumorigenic properties of CBG, showcasing its efficacy in reducing cell proliferation, migration, and survival in various tumor types, including prostate cancer, glioblastoma, colorectal carcinoma, pancreatic cancer, and breast cancer. The combination of CBG and conventional chemotherapy agents holds promise for enhancing treatment. The emergence of antibiotic-resistant bacteria poses a significant threat to global health. CBD and various terpenes have been reported to have antibacterial activity. However, it is CBG that has garnered increasing interest for its potential antibacterial properties. Studies highlight its effectiveness against staph infections and Streptococcus mutans, a bacterium associated with dental cavities. Interestingly, CBG also demonstrates activity against some gram-negative bacteria, like Vibrio harveyi, which is a bacteria that leads to the affected animals glowing in the dark, found primarily in marine animals. This suggests that CBG has the potential to treat a wider range of infections, including bacteria, that are highly resistant to antibiotics. The effects of CBG on the cardiovascular system, particularly blood pressure, are largely under investigation. The precise mechanisms by which CBG lowers blood pressure remain unclear. It is believed that CBG's role in pain management may be indirectly linked to blood pressure. Chronic pain can lead to elevated blood pressure, and CBG's pain-relieving properties might contribute to overall blood pressure regulation. CBG is the only known cannabinoid that activates the adrenergic receptor in addition to blocking the CB1 receptor. Consequently, CBG emerges as a promising candidate for therapeutic exploration in combating type 2 diabetes. The potential of CBG to regulate fat cell formation and improve insulin sensitivity implies a prospective avenue for enhancing metabolism, fostering more efficient calorie burning, and facilitating weight loss. CBG makes up 10% or less of all cannabinoids in cannabis at harvest time. To maximize CBG content, plants are harvested earlier in the flowering cycle than for other cannabinoids, often around 6 to 8 weeks. This is because CBG naturally converts into other cannabinoids as the plant matures. Products high in CBG will be found in concentrates such as RSO and tincture, as well as edibles. CBG is known for its potential to enhance focus and mental clarity, making it a good choice for daytime use, especially before activities that require concentration. As with all cannabis products, every person is different, and some people do experience the opposite effect and find it sleep-inducing. Cannabis research is still in its early stages. Therefore, while progress is being made, it is important to always consult your doctor before using cannabis to treat any medical conditions. Thank you for joining us. If you're still with us and willing to go deeper into the weeds of cannabinoids, as we continue to explore the most common cannabinoids found in today's cannabis market, hit that like and subscribe button and leave us a comment. Until next time, peace.